Assalamualaikum and good day. Today's chapter, we will learn about manual handling. At the end of this chapter, you should be able to first understand the manual handling risk factors, and second is able to manage manual handling risk factors to prevent the musculoskeletal disease. There is two acts that are related directly and indirectly with the ergonomics and also manual handling in Malaysia. So the first act, as you know, that OSHA 1994, Personal Safety and Health Act, which is that this act have the objective is to promote an occupational environment which is adapted to the physiological and psychological need of the workers. Meanwhile, for the second act is about Factory and Machinery FMA Act in 1967, which is in this act, it stated that no person shall be employed to lift load so heavy so as to cause bodily injury to him. What is the meaning of manual handling? So manual handling actually is the task of lifting, holding, carrying, pushing, pulling, lowering, and while moving, and also the packing and storing object. So this is actually the definition of the manual handling. And then we handle these objects repeatedly or occasionally as part of our occupational work. So to avoid overexertion and injuries, actually there are some solutions that can be done. First, instructions and training on how actually to live properly. And the second one is ergonomic design of material, container, and also the workstation. Manual handling, known as one of the risk factors that will affect your back. So here is your back. So here, this is the disc. Yeah. So akan berlaku kemerosotan struktur tulang rawan, tulang belakang, sehingga ia menonjol dan menekan saraf tunjang. So here, that will happen to your back. In biomechanical criteria, the L5, which is the lumbar 5 and also sacrum 1, actually this is the site of the greatest stress during lifting. Yeah? So the compressive force at this joint is the critical stress factors, and the maximum of the compressive force here in this joint actually is 3,400 Newton. Why musculoskeletal disorder issue is very important and why we need to prevent from this disease. So based on previous research and also some statistical data that we get in overseas and also in our country, in Malaysia. So one of it is because in UK, for the reason, the most prevalent reason for absent from work there is because of the musculoskeletal disorders. And the second one is because of the psychosocial disorder, which is like the stress, anxiety, and etc. Meanwhile, in Malaysia, there are many data have been published about the musculoskeletal disorder statistic. This is be under the occupational health disease that have reported to the SOCSO. Yeah. So as we can see here, most of the MSD case reported were caused by strenuous movement. And then we got also the data that compensation costs average about 28,400 ringgit for male below than 45 years. Meanwhile, about 22,738 ringgit Malaysia for male above 45 years old. And then this person suffer MSDS back location with average compensation cost about 28,117 ringgit for male younger workers. Meanwhile, about 21,941 ringgit for male older workers. And about victim had a sprain and strain injury. It's about 27,683 ringgit for male younger worker, and also 23,875 male older workers. So for based on this data, we can see that most of the victim are the workers that get this MSD, especially back pain, sprain, and strain injury. The most is the male younger workers, which is that the age is below than 45 years old. Total amount of compensation for occupational disease that related to ergonomic in Malaysia increased from 1.04 million in 2009 to 1.94 million in 2014. So in 5 years, there are about 900,000 ringgit increasing. So based on that data, we can see that hip and also back is the most part body that effect for musculoskeletal disorder, which is for the back about 51.2%, and for hip is about 28.86%. This figure shows us about the ergonomic risk factors, which is the awkward posture, contact stress, vibration, static and sustained posture, repetitive motion. And for manual handling, actually, the ergonomic risk factors that include in manual handling, that relate to manual handling, is forceful and also the sustained exertion. So actually, this is the most risk factors that are related to the manual handling. And also the awkward posture, repetitive motion, and static and sustained posture. For the forceful and sustained exertion, this is based on the lifting and then lowering, pushing, pulling, carrying, and moving load using hands or through the application of bodily force. So actually, this is the variable or the parameter that under forceful and sustained exertion. As I mentioned before in the beginning of this chapter, so the activity that involve in manual handling is lifting, carrying, lowering, pushing, pulling, and any object or load, and also seizing, holding, grasping, turning, or otherwise working with the hand or hands. This slide shows us about the effect of the manual handling to the back injuries. So this occupational group, because of the repeated and prolonged strain here, based on HSEUK in 2018, about more than 25% of occupational accident reported associated with manual handling, and this manual handling have or give a long-term effect to the back injuries. About over 70 million working days are lost, and also 70 recurrence rate of back injuries. And here is the example of occupational group like the teachers in Tasca or Tadika, so they have a risk to get the back injuries because they always bending their body when they teach the student, when they try to reach the student, because of as you can see here, the size of the table, the height of the table, that this table is matched with the student's size. So this teacher have to bend their back every day if they would like to teach the children. So they got the high risk to get the back injuries because of this repeated and also the prolonged strain. This figure shows us our spinal column. So this spinal column actually is divided into three parts, which is cervical, thoracic, and also lumbar. So here is the cervical, C1 and the C7, and then thoracic, and also lumbar, L5, and also here is sacrum. Yeah. For this figure, the left side, here is the, as you can see, your spine. So here is the spinal disc, the normal spinal disc, and here is when our spinal disc get damaged. Yeah? So this will out, yeah, from the place. And this one is the strong ring and also the soft nucleus. And here is the spinal cord. This one is spinal nerve. And this one is annulus fibrosus. This one is nucleus pulposus. Okay, and this one is normal disc. This one is normal disc. This one is hernia disc. Yeah. So as you can see here, this is the compressed nerve here, root. So this is the damage. This here, this one also, as you can see here, this one is like the normal position, and this one you get the hernia. For manual handling and lower back pain, we always heard about the lower back pain will affect the lumbar, L1 until L5, due to unsafe manual handling. Why? Because most of the body's weight is at the upper body here. Okay, and here is the lower body. So this lumbar is connect from our upper body and also the lower body. So that's why this lumbar have the important roles in our body. That's why if this lumbar gets stressed because of the maximum force there, so yeah, that will affect have a long-term effect. You will get the musculoskeletal disorder, and it will also affect the nerve area, which is that this one is a sciatic nerve, this one, and this one is the big one, the big sciatic nerve. This figure show us the MRI of the spine. So if your spine already damaged and then you got the slip disc, so actually this is the last solution that you can do. Yeah, you will need you need to do the spine surgery here. So the spinal fusion, this is the surgery that permanently joins together one or more bony vertebrae of the spine. So the doctor will install this pedicle screw in your spine, so it can join your body. Okay, so this is yeah, if you already done the surgery, so this is the condition, and will you accept this all with your body? So I think we need to respect our body and restore your original body. That's why we need to prevent our body from the musculoskeletal disorder. This worker need to load this heavy object, which is the load is about 45 kg. So what should he do? Actually, when we get this kind of task, we need to consider what is the risk factor that involved in this task. Okay, this one is manual handling task. So he need to consider 4 risk factors. The first one is task, second one is individual, the third one is load, and last one is environment. So he need to think first. The first one, the task factor. You need to check, and then you need to think and ask, this task is manageable? If yes, so you can click yes. And can the height of the lift be made more suitable, or can twisting or repetitive movement be reduced? Does the operator need to push or pull the load, or can mechanical aid be used? So you need to minimize the distance, you need to minimize the load every day. You need also to minimize also the awkward posture and so on. Okay, so if all the answer is yes, so maybe the task factors is safe. The next factor that you need to consider is individual. How is the condition of the person? How is the condition of the operator? Are they fit and trained to carry out the task? Does it require unusual capability? So please don't ask a pregnant woman to lift the heavy load, example. So that's why you need also to consider the individual risk factor. Next is about the load itself. Is it awkward shape? Is it heavy? Is team handling required? Or maybe is the load is hazardous? So actually, based on the recommended weight limit in the US, a allowable maximum load to be lifted for male is about 23 kilogram in optimum condition. So what is optimum condition here? Meaning that the vertical distance is less than 25 centimeter. The load is managed by both hand, and horizontal distance less than 25 centimeter. The last factors that need to consider is environment. So is there enough space, and then do the different surface have be crossed? Is it cold so that the touch sensation may be less, and so on. For environment, the optimum condition for temperature is about 19 to 21 degrees Celsius, humidity about 30 to 50%, and illuminance is more than 200 lux. So next, we learn about actually what is the relationship between the manual handling and also the human anthropometry. This figure, you can see that this is the basic anthropometry. We also have learned this in our anthropometry chapter. So there is body height, eye height, shoulder height, elbow height, And then this one is body depth and also the knuckle height. The relationship between the manual handling and also the human anthropometry is applied in this figure. So based on the guideline for lifting and lowering load, based on the ISO 11228 part 1, we can see this relation. So based on the previous slide, that we can see that the basic anthropometry of the body height, which is there is lower leg height here, knuckle height, elbow height, shoulder height, and full height. So the guideline for lifting and lowering load in ISO 11228 part 1, it mentioned that for lower, if the male would like to lift the load from the floor to the lower leg height, and the load is far from his body, so the maximum load is about 5 kg that he can lift. And when, example, the female operator would like to lift the load from this lower leg to knuckle height, and the position of the load is near to the body here, so the maximum weight is about, the maximum recommended weight limit is 13 kg. So in this guideline, the variable that involved for the recommended weight limit is the body anthropometry, basic anthropometry, and also the distance, the distance or the position of the load itself, is it near or far from the body, and also the gender, is it male and also female. Another example, when the male operator need to lift the load every day is from the shoulder height to the full height or above the shoulder, so and then the load he bring is near to the body, so here is near to the body, and so the maximum load that he can take or he can lift is about 10 kg. Meanwhile, if the load he put far from his body, like this one, so the maximum load that he can lift is about 5 kg. So based on your observation and also based on your identification, so you can do the workplace assessment and use this table. This table also have in the initial era. So actually this table also come from the ISO 1128 part 1 for lifting and lowering, and also the carrying. Meanwhile, for ISO 11288 ISO 11228 part 2 is about the pushing and pulling, and ISO 11228 part 3 is about the lifting load in the high frequency. So actually for manual handling, that is the three ISO that available. So you can write here, and then based on the working height and recommended weight limit. We have learned the relationship of the manual handling and also the body anthropometry. Next is the relationship of the manual handling and also the repetitive movement. The repeated movement of the same groups of joint and muscle. So here, if it's too frequent, too quickly, and also in long duration, so this will affect your body, especially your back, and it in the long term, it will it will affect your in the long term, you will get this musculoskeletal disorder. So when we sit, the repetitive is high if the cycle time is 30 seconds or less. This is another guideline in ISO 11228 Part 1 for lifting and lowering load and also the repetitive movement. So there are three conditions. If employee repeat operation once or twice per minute, so the weight limit that you get before, you need to reduce it about 30%. When the employee need to repeat that operation 5 to 8 times per minute, so you need to reduce the weight limit about 50%, and if more than 12 times per minute, so you need to reduce about 80% from the weight limit. Another guideline, if the condition is there is a twisting movement in the operation, so if employee twists the body from forward facing to the side about 45 degrees, so the weight limit should be reduced by 10%. If the employee twists the body about 90 degrees, so we need to reduce the weight limit about 20%. For pushing and pulling, force is applied with the hands. Pushing and pulling condition, the hands is between the knuckle and shoulder height, and the distance for pushing or pulling is less than 20 meters. The load is being supported on wheel. This pushing or pulling also using a well-maintained handling aid, that is, the wheels are properly aligned and in good condition. This is the recommended weight limit for pushing and pulling. This is still adopted from the ISO 11228 Part 2 for pushing and pulling. So for stopping or starting a load, male, approximately about 1000 kg load on smooth level surface using well-maintained handling aid. Meanwhile, for female, about 750 kilogram load, equivalent to 150 Newton pushing or pulling force on smooth level surface. Meanwhile, the activity for keeping the load in motion, about 100 kg load on uneven level surface, and for female is approximately 70 kilogram load on uneven level surface using well-maintained handling aid. In the guideline also, there are recommended weight limit for seated position. So for female, the maximum load is about 3 kg. Meanwhile, for male, is about 5 kg. This table shows us some factors and also condition in carrying activity. Here also included in ERA, Ergonomic Needs Assessment, based on guideline DOS guideline. So I think you already learned about this in our chapter, the initial ERA or Ergonomic Needs Assessment chapter. So the factor, there are floor surface, carry distance, obstacle and road, and condition, and the outcome is acceptable, or maybe you need to conduct advanced ERA. Next is about static and sustained posture. About minimal or restricted, maybe also no movement, where the body held on to a particular position over a prolonged period. So this is the definition of static and also the sustained posture. Is it problem? How about if we adopt this posture frequently? So actually, yes, this static and sustained posture is a problem. The short-term effect, you will feel a fatigue, and then this fatigue, if you not prevent from fatigue, this fatigue will become worse, and it become pain. And if you also don't prevent this, don't do something changes, so this pain will increase the stage, become the injuries. That's why injuries, it's a long-term effect about these factors. When we see the prolonged standing, if the standing position for duration more than 2 hours, and meanwhile for prolonged sitting, we sit this is prolonged sitting if the sitting is for duration more than 30 minutes. This is safe technique for manual handling. So maybe who come to the training for lifting, maybe you already know about this. So the safe technique for manual handling. So please plan your lift, checking you have a clear road, and then face forward, don't bend your neck, keep your back straight, yeah, to prevent your back from MSD. Don't stack boxes if this will obscure your view. Bend your knees, not your waist, and lift with your leg muscle. And then get a good grip or coupling, and wear appropriate footwear. Keep your foot, keep your shoulder width apart. Keep your feet shoulder width apart. This actually is 5 basic safe steps. So first you need to think how I can handle this load, how I can lift this load safely, and then adopt stable position, and then after that you bend your knee, and then bring the load close to your body, near to your body, and then put the object down as soon as possible when you arrive to the destination. This is a simple solution. If you have the grip, your grip is poor, so please do something, and then give a safe handle and a good grip. This one is example of good grip using the power grip. And then if the load is too heavy, you can prevent the workplace injury by team handling. Always use 2 people to lift a pallet. This is also example of manual handling aid. This one you need to prevent, yeah? Prevention measures. So this is example of poor posture, forward head, flat back, yeah? This is example of good posture. So balance, upright posture. This is also example of a poor posture. The rounded shoulders, weak abdominal muscles, and so on. Do stretching for your healthy back, especially when you involve in prolonged standing, prolonged sitting. So you need to stretch your back, and then do some exercise for prevent your back from the musculoskeletal disorder. Smoking and back pain. So actually, previous research also have proof or got the result that there is a significant relationship or correlation between the smoking and the back pain. So this smoking impairs the blood flow. It will resulting in oxygen and nutrient deprivation to the spinal tissues. Your plans for tomorrow depend on safety today. So please don't delay about the safety. So today you start to be safe. That's all for the chapter of manual handling today. Thank you everyone, and Assalamualaikum warahmatullahi wabarakatuh.